Welcome to Section 5. In this section, we will be discussing how to manage shock. Shock. Shock occurs when the body's circulation system does not supply enough oxygenated blood to the body tissue. In plain language, it means that there is a sudden drop in blood pressure, and the heart, the blood pump of the body, no longer acts as pump, but starts acting like a machine, and starts beating so fast that it actually does not pump blood efficiently to the body. All external bleeding must be controlled. Common symptoms. The following symptoms could be present: cold and eventually blue skin. Skin may be moist. The patient may be very weak. Pale. Altered consciousness. Restlessness or irritability. Have a rapid pulse. Breathes rapidly. Treatment. The patient must be laid down, feet elevated not more than 20 centimeters, and are covered with a blanket to maintain his or her body temperature. The patient must be calmed down and reassured of assistance and help. Medical assistance must be called immediately. The breathing and pulse of the patient must be monitored, and the patient should not be left alone. No food or liquids must be given. The patient may need surgery. Food and liquids would only worsen the situation and cause nausea resulting in vomiting. The shock position and when to use it. Normally the lower extremities should be elevated. This may improve the blood supply to the heart. If suspected of fractures, the legs should not be elevated if not well splinted. Ideally the patient should lie on one side so that if he or she vomits, it will not block the airway, this preventing asphyxiation. There are different types of shock. We will discuss a few types. Hypovolemic shock. This is the most common type of shock, and based on insufficient circulating volume. Its primary cause is loss of fluid from the circulation, from either an internal or external source. An internal source may be hemorrhage. External causes may include extensive bleeding or severe burns. Distributive shock. As in hypovolemic shock, there is an insufficient intravascular volume of blood. This form of relative hypovolemia is the result of dilation of blood vessels, which diminishes systemic vascular resistance. Examples of this form of shock are septic and anaphylactic shock. Septic shock is caused by an overwhelming infection. Anaphylactic shock is caused by a severe allergic reaction to an allergen, antigen, drug, or foreign protein, causing the release of histamine, which causes widespread vasodilation. This leads to hypotension and increased capillary permeability. Signs and symptoms of hypovolemic shock. Anxiety, restlessness, altered mental state, due to decreased cerebral perfusion, and subsequent hypoxia. Hypotension, due to decrease in circulatory volume. A rapid, weak, thready pulse, due to decreased blood flow. Cool, clammy skin. Rapid and shallow respirations, due to sympathetic nervous system stimulation and acidosis. Hypothermia, due to decreased perfusion and evaporation of sweat. Thirst and dry mouth, due to fluid depletion. Fatigue, due to inadequate oxygenation. Cold and mottled skin, especially in the extremities, due to insufficient perfusion of the skin. Distracted look in the eyes, or staring into space, often with pupils dilated. Signs and symptoms of anaphylactic shock. Skin eruptions, and large welts. Localized edema, especially around the face. Weak and rapid pulse. Breathlessness and cough, due to narrowing of airways, and swelling of the throat. Treatment of hypovolemic shock. In hypovolemic shock, caused by bleeding, it is necessary to immediately control the bleeding. Thereafter, follow treatment as for shock.